We are in the thick of the holiday season, and I myself am in a car on my way home to visit my family. So I figured, what better time to talk about struggles people have when they go home to visit their family for the holiday season? Something that is definitely not spoken about enough, at least publicly, is people who really struggle to spend time with their family members. I'm a therapist. I see the inside lives of many, many people, and I can tell you that this is actually way more common than you would suspect. What can we do if you are someone who experiences this? Maybe you are dreading going home. You know that there's going to be a lot of arguments. You're going to be shut down. You feel like you kind of have to shut yourself down. How do you manage this? For starters, don't be afraid to set boundaries. And difficult families don't always like boundaries, especially if there's a lot of enmeshment involved between individuals in the family group or family dynamic. For those of you who don't know what enmeshment is, it's basically when there is this intertwining of thoughts and emotions between family members and identities blur. And people aren't really able to have their own autonomy, their own individual identity with their own unique beliefs and thoughts that are actually separate from their family members. There tends to be a lot of codependency. There tends to be a lot of challenges that come up when there's someone in the family that disagrees with the rest of the group. People can't really handle that. They start to get upset. There's also just a lot of families where there are individuals who have not done their work. They haven't worked through inherited traumas or traumas that they've experienced on their own wounds, their own issues that they tend to place onto other people instead of taking accountability for themselves and their emotions. And there's a ton of other things that I'm not even thinking about to explain that might happen in family dynamics that make it really challenging to go home. If this is you, if this is something that you struggle with, the first thing I would suggest is starting to think about boundaries that you would want to put in place to help make the experience of going home at least slightly more tolerable. Now, if you come from an enmeshed or dysfunctional family, there's going to be a lot of people who don't like when you put up boundaries because those family dynamics thrive on a lack of boundaries. If you realize that you might struggle with putting up boundaries because of the discomfort that arises in you when you upset or disappoint family members, definitely go back to my video about how to tolerate uncomfortable emotions. Setting boundaries will look like different things to different people. For some people, it might mean limiting the amount of time they're with their family. So maybe instead of staying at their family's house, if they can afford it, getting an Airbnb or a hotel nearby so you have a place to go retreat to and take care of yourself before and after meals. It might mean making sure that you're taking care of yourself in other ways. Maybe you find a place that you can get a day pass at a gym so you can really take care of your health and well-being and make sure you're moving and working out. It might look like making sure you have the food and the water that you need in order to feel good and not always eating what everyone else eats just because that's the thing to do. It might mean shutting down conversations. Maybe there are people who bring up topics that you don't want to speak about and finding a way to very nicely decline and engaging in those conversations. Boundaries might mean only going to some of the holiday events and not all of them, and that's okay. It might even look like taking a bathroom break in the middle of a difficult conversation or stepping outside and going for a walk when you need time to yourself or to get away or to just process things. And I'm going to be so real with you. If setting boundaries means not going home at all, that is okay too. Let's say you do go home and you know that people are going to be very difficult. How do you start to actually deal with it? Now, we can't change our families, but we can work on how we interact with them, our relationship to the experience that we have, and understanding a little bit of why our family behaves the way that they do. The reason that can be helpful is because it's a reframe for us. When we see our family as they are, inherited trauma and all, difficult lives, situations that we can't change, and sometimes they just don't want to change or are not able to, it sometimes allows us to have a little bit more compassion for our family members. That doesn't mean you have to change the way you feel about them or the way you interact with them, but it might make it just a little bit more tolerable to be around them. Something that I do a lot with my patients is a little bit of a kind of family constellation exercise where we have a conversation with the family member, not in the room. They're not there. They don't know where we're doing it, to better understand what might be happening for that family member, what they may have gone through that is leading to them interacting with us in this particular way. Something that I do a lot with my patients is we set up a situation in the therapy room where we have a conversation with the difficult family member. Now, the family member is not present. They don't know that we're doing this, but we pretend. We pretend like the family member is there, and we go back and forth between the patient and the family member, asking questions, exploring, coming from a place of really compassion and curiosity to understand what is going on for that family member. What have they been through? And why do they behave the way that they do? This experience that we do in therapy has helped so many of my patients drastically to be able to better be around family members and tolerate the challenging dynamics a little bit easier. So if you are someone who struggles with being around family members, I highly encourage you to try out an exercise like that, or perhaps find a therapist like myself who does family constellation, inherited family trauma work, or internal family systems work, or something similar like that. The other thing that I think is really important to prepare for before you go home to spend time with difficult family members is to make sure that you understand how to regulate yourself, how to start to calm your nervous system down, especially when you start to get amped up. Maybe you get frustrated or upset really easily when you are engaging with these family members. So, what does this look like? What does it look like to have tools and tricks and techniques in your back pocket to help emotionally regulate, calm you down when you are feeling overwhelmed, upset, dysregulated, things like that? First of all, I always love some great breathwork exercises. There's so many different variations of breathwork that you can do that help you start to get into your body to calm your nervous system down. So, if that is you, I highly suggest maybe looking up some YouTube videos if you don't really know where to start. And I will definitely be making some breathwork videos in the future and putting them on this YouTube channel. I'm sorry they are not up yet in time for the holiday season, but they will be, and you will be able to use them in the future for future visits with family members. Other things that I love: vagus nerve stimulators, vibration plates, things that are going to help calm your nervous system down, get you into your body. Movement. I almost always make sure I exercise the morning of seeing family members. Other things that you can try if you want to know what you can do to help regulate your nervous system. I have a program on my website that I sell. It's called I Hate Meditating, and it is the top nervous system regulating tools and techniques that my patients love to use in our practice and in their day-to-day life to help get themselves into their bodies. Personally, I always make sure I have some of my favorite supplements on hand before and during seeing family members. For example, L-theanine, magnesium, ashwagandha. Always consult with your medical provider before trying any new supplements. These are things that I like to use, but you have to make sure that they're going to work for you. So remember, this is not medical advice. Lastly, set an intention for yourself before you go in to time with family members. See if there's a way that you can get a little bit of meaning out of the experience of being with them. Even if most of it is difficult, there is a reason you're going if you do choose to go. And I bet it has to do with the fact that you still love your family and you do want to make meaningful memories with them. So try to set a little bit of an intention or have a thoughtful moment to yourself before stepping into what might feel like absolute chaos. And most importantly, don't forget to have some compassion for yourself. It might sound a little corny or cheesy, but it's the most important thing that you need right now to get through this holiday season. So if you are about to go in and spend some time with family, take a nice deep breath. Send yourself some love. Send them some love. Know that you are doing the best that you can and that they are doing the best that they can, even if it doesn't always feel that way. Wishing you all a lovely and hopefully tolerable holiday season.